This is The Week in Addiction Medicine, a podcast resource of timely news and top stories brought to you by the American Society of Addiction Medicine, ASAM.
Today is Tuesday, June 30th, and I'm Zach Caruso. Our lead story this week is in the Journal of Studies on Alcohol and Drugs and is titled Alcohol Intake and Health Study, No Protective Effect at Low Levels with Mortality Increasing to 1 in 25 at 14 drinks per week. This study used a cause-specific modeling approach to estimate the lifetime risk of alcohol-attributable mortality and morbidity in the United States based on a person's average lifetime weekly alcohol consumption to assess the impact of per-occasion alcohol consumption on health. Researchers found that alcohol consumption, including at what may be perceived as, quote, moderate levels, is associated with increased mortality and morbidity risks. These results support tightening alcohol use guidance in the United States for both males and females to no more than 1 drink per day. Next is an article in Addiction and is titled Factors Associated with the Percentage of Individuals Who Initiate and Discontinue Naltrexone as a Relapse Prevention Pharmacotherapy in Opioid Use Disorder, a Systematic Review, Meta-Analysis, and Meta-Regression. Naltrexone is an approved treatment for OUD, but prior studies have shown low rates of initiation and high rates of discontinuation. Researchers conducted a meta-analysis to evaluate naltrexone initiation and discontinuation rates, along with individual and study-level factors associated with both. In pooled analysis, oral naltrexone initiation rate was 60% and long-acting injectable initiation rate was 18%. Rate of discontinuation of oral naltrexone was 50% at 1 month and 71% by 6 months, while discontinuation of injectable naltrexone was 26% at 1 month and 60% by 6 months. Researchers did find that naltrexone initiation rates were higher when offered alone versus when offered along with methadone and/or buprenorphine. Authors did not find any difference in discontinuation rates when psychosocial interventions were provided along with naltrexone. Our next article is in JAMA Network Open and is titled Short-Acting Opioid Dose and Patient-Directed Discharge in Hospitalized Patients with Opioid Use Disorder. This retrospective cohort study looked at hospitalizations of adults with OUD who were treated with short-acting opioids between February and December 2024 and factors associated with patient-directed discharge. The study included 669 hospitalizations at an urban safety net hospital in San Francisco, with 520 unique individuals. Of this group, 13% resulted in early patient-directed discharge. Each doubling of a patient's daily dose of short-acting opioids was associated with an 8% reduction in the hazard of early patient-directed discharge. There was not a statistically significant association between time to first dose and patient-directed discharge. Our next article is in the Harm Reduction Journal and is titled Stigma Toward Individuals with Cannabis Use Disorder Across Age Groups, Associations with Familiarity and Sociodemographic Characteristics. This survey-based study in Germany sought to investigate the possible effects of sociodemographic factors and familiarity with cannabis on stigma toward individuals with cannabis use disorder, or CUD. A professional survey institute completed a quota sampling web-based survey of 1,600 individuals, including 501 adolescents. Of the participants, 41% reported prior use of cannabis, with 11% reporting use in the past month, and 36% reporting knowing someone with CUD. Participants were presented with 2 case vignettes of individuals with CUD, including an adult and an adolescent vignette. The adolescent case was significantly more stigmatized compared to an adult case. Survey respondents who were more familiar with cannabis use and CUD reported less stigmatizing attitudes, with a more pronounced effect of familiarity for adolescents compared to adults. Next is an article in the American Family Physician and is titled Gambling Disorder, Diagnosis and Treatment. Gambling disorder is a behavioral addiction with increasing prevalence, likely driven by expanded access to gambling, and remains underdiagnosed despite its potentially disabling consequences. Although more common in men, incidence among women is rising, with risk factors including comorbid substance use and psychiatric disorders, lower socioeconomic status, and engagement in other high-risk behaviors. Screening guidance is limited as the U.S. Preventative Services Task Force has not issued recommendations, while UK guidance supports case finding through direct questioning, with diagnosis and severity determined using DSM-5-TR criteria. Evidence for treatment suggests short-term benefit from pharmacologic agents such as naltrexone and olanzapine, and from psychotherapies including cognitive behavioral therapy and motivational interviewing. Long-term efficacy remains uncertain, and support groups offer adjunctive psychosocial benefit despite limited empirical support. Next is an article in JAMA Network Open titled Projected Outcomes of Reducing Federal Funding for Syringe Service Programs via Executive Order. Syringe Service Programs, or SSPs, receive funding from the federal government. A July 2025 executive order put funding in question and threatened legal action for those who, quote, knowingly distribute drug paraphernalia. This study used microsimulation to model the effect of SSP service reduction on the health of the estimated 3.6 million persons who inject drugs in the U.S. Researchers modeled both low SSP service reduction and high service reduction projected to last until 2030. The paper includes an extensive discussion of the data and assumptions used in the model. With low service disruption, the model predicted 5,400 excess all-cause deaths with 2,200 excess overdose deaths. With high service disruption, the model predicted 39,000 excess all-cause deaths with 15,000 excess overdose deaths. Reducing SSP funding will result in increased mortality. Our final article is in Drug and Alcohol Dependence and is titled Cannabinoid 1 Receptor Agonists Block Fentanyl Condition Place Preference, but not Fentanyl Antinociception. There is interaction between the cannabinoid or CB and opioid systems in the brain. Conditioned place preference, or CPP, is an addiction model where animals spend increased amounts of time in areas of their cage associated with drug administration. Rimonabant, an agonist/antagonist at the CB1 receptor, attenuates CPP in mice for fentanyl. However, its agonist properties produce undesirable side effects. This study investigated the effect of two CB1 receptor antagonists on CPP for fentanyl in mice and found that both attenuated CPP for fentanyl without the side effects of rimonabant. Analgesic potency was assessed by the time it took the mice to flick their tails out of hot water and found that fentanyl's analgesia was not significantly reduced by either CB1 antagonist. These antagonists have potential in the treatment of OUD without affecting opioid analgesia. This concludes today's episode of This Week in Addiction Medicine. Remember to subscribe to the ASAM Weekly for more exclusive content and our editor's commentary delivered every Tuesday. Be sure to check us out on social media and at asam.org. Thanks for listening. We'll be back next week.